we think of child development, we need to go all the way back to the beginning, conception and prenatal development. The development process is broken into 3 parts, the first, second, and third trimester. The first trimester being conception through the 3rd month, the second trimester being the 4th through the 6th month, and the third trimester being the 7th through the 9th month. We also refer to pregnancy as fetal development, and it has 3 stages. The first one is called the germinal stage, and that's when the union of the ovum and the sperm produce a zygote. The cells continue to divide and develop around the 14th day, and then a small mass attaches itself to the wall of the mother's uterus. And this marks the beginning of the embryonic stage, which is the next stage. Only about 2/3 of the zygotes actually survive this phase. Then the embryonic phase is about the 3rd week through the 8th week. This is when the major organs, the heart, the lung, the digestive system, the brain, all these things are formed and have many functions by the end of this period. They are functional by the end of the period, and this is when the placenta begins to form. Babies receive nutrients and hormones through the placenta, and the placenta also removes the fetal waste during pregnancy. The fetal development is the 9th week through the onset of labor, so that's the biggest one, and it takes about 38 weeks for a child from conception to delivery. The fetus is capable of surviving at 7 months, although it might have major problems and have to have hospitalization and oxygen and things like that. Healthy development of a baby requires a healthy mother. So beginning with early prenatal care is the most important part. Lack of prenatal care is associated with increased medical complications, preterm birth, low birth weight babies, infant death, and disabilities. Nutrition. A healthy diet lessens the risk of a low birth weight baby or a premature baby. Pregnancy increases a woman's dietary need for calories, and so she needs to take in more protein, more fluids, and certain vitamins such as folic acid, vitamins B, C, and D. Studies show a critical link between folic acid and the intake and reduced incidence of neural tube defects such as spina bifida and cleft lip and cleft palate deformities. So it's really important for the woman to get the folic acid. That usually comes in prenatal vitamins, and that usually comes with, it's also in green leafy vegetables. So having a good diet at conception, having a good diet immediately after conception is important. As far as weight goes, most women gain between 25 and 35 pounds over the 9-month period. Considerable gains over or considerable gains under can pose a risk for both the mother and child. If the mother gains a lot of weight, she oftentimes has gestational diabetes and has to go on a special diet in order to maintain the weight, and so it doesn't affect the insulin level of the baby. Or having too little weight, it might affect the development of the child as well. The age and general health for birth, the optimum time for a mother to give birth is in her 20s to early 30s, and teens experience a higher rate of premature births, a higher rate of low-weight birth babies, a higher rate of infant deaths, and infants born with developmental disabilities. And this rate is nearly double for teens as it is for women that are in the optimum zone. The problems are often associated with inadequate prenatal care, with poor nutrition, poor housing situations, substance abuse, or all 3. Pregnancy in older women also presents a set of concerns. The eggs usually deteriorate as a woman ages, thus increasing the probability of certain birth defects such as Down syndrome. Male sperm also deteriorates with age and exposure to environmental contaminants and may increase the risk of autism and other birth defects. Older mothers also experience more medical problems during pregnancy. So some of the threats to fetal development. Environmental substances, they're called teratogens, and they can be the most damaging during the early weeks. Some of those teratogens or environmental threats are alcohol, smoking, drugs, chemicals, pesticides and insecticides, some medications, and maternal infections and x-rays. Alcohol is especially damaging to the fetus nervous system during the first trimester. Fetal alcohol syndrome, which causes mental and growth retardation, behavior and learning problems, hyperactivity, poor motor coordination, heart defects, characteristic facial deformities. Their eyes are set wide apart. They have shortened eyelids, flattened nose, and they have speech impairments. When alcohol is consumed later in pregnancy, it affects the proper fetal growth. Smoking. Cigarette smoke contains nicotine, it contains tars, it contains carbon monoxide, and these enter through the placenta and interfere with the normal fetal development. Carbon monoxide reduces the amount of oxygen to the fetus. Oxygen deprivation seems to correlate with learning and behavior problems, especially as the child enters school. Mothers who smoke are more likely to miscarry, they're more likely to have premature births, they're more likely to have stillborn infants, and they're more likely to have low birth weight infants. Their babies are at a higher risk for SIDS, sudden infant death syndrome, and a range of other acute and chronic respiratory problems such as allergies and asthma. Studies also show that attention deficit disorders are more common among children whose mothers smoke during pregnancy. Chemicals and drugs. Some of the chemicals are analgesics. Those are Tylenol, ibuprofen, naproxen. Antibiotics, anticonvulsants, things that if you have a seizure disorder. Anticoagulants, those are things that are blood thinners. Antidepressants. Antihistamines, things you take for a cold. Antihypertensive, those are drugs you take for having high blood pressure. Some cancer and arthritis drugs, some antiviral drugs like for HIV, some hormones, large doses of vitamin A like in Retin-A for skin, thyroid medication, diet pills, nicotine, cocaine, heroin, marijuana, methadone. Those are all things that can damage a baby. Maternal infections during the first 4 weeks. These infections can put the baby at high risk for heart problems or being deaf or being blind. Some of those infections might be chickenpox, diabetes, Fifth's disease, herpes, HIV, mumps, rubella, syphilis, and toxoplasmosis. When an infant is born, an infant is given a score called an Apgar Score, APGAR, and they're given a score at birth, at 1 minute, and at 5 minutes. And the Apgar stands for A, stands for the appearance of the baby's skin. They're looking if the child is bluish or if they're pink. P stands for pulse, and the pulse rate that's rapid and decreases. Grimace. A is activity, and R is respiration. So up to 2 points is awarded in each category, with a total of 10 being the top score. And the baby scored immediately after birth, then at 1 minute, then at 5 minutes. A score of 8 is considered normal, a score of 8 at 5 minutes. This is an indicator of how well the child is at the moment, but not a predictor of later health concerns. The main problem is if a child doesn't improve their score after they're born. It's normal for a child to have a lower score, and then they might be a little blue when they're born, and then they start to pinken up a little bit. They might not cry at first, but then they end up crying, and so that oxygen gets around in their blood. So the important thing is to see the score go up and the child look healthy, as opposed to a child that stays blue and is not getting oxygen.